Always good to hear that music on a Wednesday afternoon. I'm John Harper, and that means that it's time for Helping Seniors of Brevard. Let's get things underway as I introduce to you the Executive Director of Helping Seniors of Brevard and the host of the program. Here is none other than Kerry Fink. Hi, Kerry.
Hey, John Harper. How is your Wednesday going today?
Well, we're doing very well. I'm very pleased to report to you and looking forward to a good show today with your special guest, Dr. Lee Sheldon.
Well, that's a great introduction, so why don't we just bring Dr. Lee Sheldon right into it? Hey, Dr. Sheldon, how are you?
Hello, Kerry. Hi, John. Happy New Year. It's good to hear your voices.
And likewise.
Absolutely, absolutely. You know, I was thinking when we were together on the radio last month, Dr. Lee Sheldon, we were talking about New Year's resolutions, and we were actually, it was really an interesting, at least for me, radio show, because we were covering a lot of the things that we ought to think about for our mouth health as we're going into 2023. And as we talked about, we came up with kind of like, or you came up with really the top 10 list of things that we want to think about so that we go the right direction. And as we've talked about so many times on this radio show, so your mouth goes, really, that has a lot to do with so your health goes and vice versa.
Yeah, and that link is becoming clearer and clearer and clearer. It seems that every time research is done, of course, and with our population, we're talking about Alzheimer's here, and there is a direct link between periodontal health and mental health, and Alzheimer's and memory loss and that type of thing. So the more we study, the more we understand that the mouth is not separated from the rest of the body.
Right. And so, by the way, listener, want to first of all take a moment and welcome you into today's show. We always gather around the radio 90.3 FM WEJF every Wednesday at 12 noon. And for those of you listening online at WEJF.net, welcome too. And then also to the growing number of listeners who find us on everything from Spotify to iTunes, podcast world. We're out there too. Wherever you find your podcast, you'll find Helping Seniors Radio. And the reason that I started talking about the show last month, Dr. Sheldon, was because that's really good advice. And in case you missed it, one of the reasons we archive everything, we just have a great library. You know, we're into our 12th year of serving the community. Joe Steckler, our president and founder, got us rolling after his successful efforts at getting Joe's Clubs and everything going on Brevard Alzheimer's. And 12 years ago, he said, we really need to do something because memory challenges aren't the only issues that seniors face. And Joe, who just celebrated his 89th birthday on December 20th, is still nonstop, like the best advocate for seniors in Brevard County. But he's always said, we've got to get information in the hands of seniors and families who care for them so they can make good choices and good decisions about their aging plan. And that's why I really thought, Dr. Sheldon, the show last month was so important to that, because it was really some good tips. There was things that I had not heard. For example, when you were talking about the type of mouthwash that we need to look for, or even the type of toothpaste. So, listener, if you didn't get a chance to catch that show, I want to remind you it's available. You can find it a lot of different places, either as a podcast or you can go directly to helpingseniorsofbrevard.org. You can subscribe to our YouTube channel, Helping Seniors of Brevard, or a lot of people like to hunt us down on Facebook. And again, it's Helping Seniors of Brevard. Shouldn't be too hard to remember, Dr. Sheldon.
And I got to tell you, Kerry, we received some phone calls as a result of that talk, because I wasn't willing to talk about brand names, so we received some phone calls to find out. So just in case you want to ask me anything about what we talk about today, give us a call at the office, 321-259-8000, 321-259-8000. And it was funny, one of the calls that came in was from someone who used to work at a place where I got my hair cut. And she said, "Do you remember me?" And this had to be at least 30 years ago. Wow. Yes, I did remember her. And so we talked about, I think it was the brand name of mouthwash. And we talked about that for a little while.
It's good information because these are things that we don't know. We get subjected to all these ads on television or whatever, and then we think we're making a wise consumer choice, but it really is good to ask an expert. In fact, Dr. Sheldon, that's kind of our theme for 2023 and the work that we do as a nonprofit of helping seniors. As you know, last year we introduced this concept. We called it "Get Your Ducks in a Row." Joe Steckler, our president and founder, he's always talked about this. He just calls it an aging plan, but we thought it sounded a little less intimidating to say, let's work on getting our ducks in a row. And as we went through a lot of the things last year, Dr. Sheldon, we realized that there is no reason that you should have to try all this stuff or map this all out on your own. I mean, the internet is a great research tool, and we all know that everything you read on the internet is 100% true and verified. So why don't we just go with that? Actually, what we keep learning is we have such great experts on any topic that you want to think about as far as it comes to successfully aging or your health or things like that are within the Helping Seniors Network. Why not take advantage of the expert knowledge? And that's why I'm excited about our topic that we're going to get into today, because this is one of those things that I think a lot of us, I really didn't get this myself until I started really till I met you, and then really started to get an understanding of how important things are with your gums, which as a periodontist, noted area periodontist, you would be the real expert at. But we're going to talk about deep cleaning and all these things related to this. We're even going to talk about why that's so important. So maybe we just dive in right there. We, usually you go to a dentist, they finish cleaning your teeth, and sometimes they'll look at you and say, well, what you really need is a deep cleaning. And what is the difference between that and just like a routine, I'm just going to get my teeth cleaned kind of thing?
Well, I'm going to have to draw a mental picture for you, Kerry. So you'll have to let me know whether I'm accurate. John, you let me know whether I'm accurate too, and see if you can get the picture that I'm describing. So this is like a radio play-by-play rather than a television play-by-play in TV. But we're going to do it for teeth and gums instead. Isn't that exciting?
Love it.
Okay. So I want you to picture the tooth that's in your mouth. Pick a tooth, any tooth you want to. You just have to keep it in your mind's eye. You know that there's gum tissue that's surrounding that tooth. Now, the gum tissue is like a collar. It's like a collar around your neck. Okay, and that gum tissue forms a tight collar around the tooth. And if that collar is tight, you have a healthy area. You have healthy gum tissue, and you have no periodontal disease whatsoever. Okay?
Okay.
Now, that collar can loosen. And the way it loosens is by having bacteria that accumulates on the tooth around the gum line. It stays there for a period of time, and rather than having a tight collar, that collar becomes swollen and develops perforations so that the bacteria can now get below the gum line. If the bacteria then goes below the gum line, the body says, I don't want any infection near my body. After all, plaque and bacteria, the same thing. And bacteria is now entering the body. And it's entering the body by gradually going below the gum line and getting onto the root surface. As a result, that collar lets go even more. Below that collar of soft tissue, there's bone and ligaments that hold the tooth in place. So the bacteria goes deeper, and that bone starts to disappear, and those ligaments start to dissolve. When you have that, then you develop something called a pocket. Pocket being an area on the tooth where you've lost some bone support and some ligament support for the tooth. You see the pocket, or the way you determine the pocket is by using a little instrument called the periodontal probe. It's a measuring device. And you probe from the top of the gum line down to the point where there's now some kind of attachment between the teeth. If that measures 4 millimeters or more, that means you have a pocket and you have an area of infection around the tooth. The deeper that pocket goes, the more, or let's put it this way, the more bone loss you have, the deeper the pocket is. And so that pocket can go to 5 to 6 to 7 millimeters or more. And the deeper it is, the more severe the infection is. The deeper the pocket gets, then the better the opportunity for the tooth to loosen and come out.
Dr. Sheldon, John Harper here. In regards to that bone loss, are you able to grow back that bone, or what happens in that case?
It depends upon how far it's gone, John. The answer is very often you can grow back the bone, but we can do bone grafting. In other words, we can take bone from another part of the mouth or even from a bottle and put the bone in there. But what's interesting, and that was one of our discoveries with the instrument we're about to talk about, is that when we get the bacteria totally off the root surface itself, in some cases the bone grows back all by itself. You don't need to replace the bone.
I gotcha. But that bone loss is critical due to that bacteria in and around that pocket, and that's what we have to watch for.
That's correct. Yeah. And this is one of those diseases where the earlier you catch that pocket, the earlier you get that bacteria, you catch that bacteria, the better the opportunity. You would rather keep the bone from being lost or catching it at an early stage rather than allow it to develop to the point where you've lost, let's say, half the bone for the tooth.
Catching that bacteria, Dr. Sheldon, is that a result of preventive medicine, so to speak, with deep cleaning? Is that how you prevent it?
I think the catching of it is first, John. The first part of this is the use of the judicious use. In other words, the careful use of the periodontal probe. The periodontal probe, if it goes below the gum line and you measure 4 millimeters or more, or if you're getting bleeding when you probe, then you pretty much know that you have active disease below the gum line.
In that active disease below the gum line, that can really cause all types of problems. Forgetting for a moment bone loss, I've heard for a long time that it can really have a catastrophic effect upon the heart tissue.
I think you're right, and there is good evidence to show that. Now, there's still a question about cause and effect or association. You know, are the two of them associated with each other? We know that's true. Have we found bacteria that ordinarily belongs in the gum disease area and found it in the heart? Yes, we found that. So we're closer and closer to a direct link. Of course, that's not the only link, but we're closer and closer to a direct link between periodontal disease, as you said, and heart disease.
Yeah, you know, I was thinking, Dr. Sheldon, when we had done a show where you were actually citing a large-scale study. I think you said it was done in Taiwan or something, but anyway, it was clearly showing that there is a lot of connection on this, and then that's one of the reasons why it's so important that we really go after this deep cleaning idea, because it's not only making your mouth healthier, but it really actually has the potential to have you feeling better too.
That's true. And the question then becomes one of what is really a deep cleaning, because there is so much involved with a deep cleaning that, well, I shouldn't say no, is so much involved. Unless a deep cleaning totally cleans the root, then you're not going to get the healing that I was referring to when John and I were talking a second ago.
Right.
In other words, you can do a deep cleaning, but it's the effectiveness of the deep cleaning that's going to determine whether, in fact, you get healing or not.
Now, so that was, I wanted to ask you about that, because I know as a periodontist, you've talked a lot about that people will come into your office, you know, there's a lot of maybe mouth pain or things going on, and they just say, listen, just take my teeth out, put in implants, put in dentures, whatever I need to do. I just got to get out of pain. And I know we've done radio shows on this before where you've talked about, hey, hold on, not so fast. Let's see what's going on, because we may not have to go to all that, I guess, drastic level if we can just see what's going on under the gum line, and that's that whole tool that I remember you kind of showed us years ago, where you were able to look up under the gum line and kind of take a look and see what was going on.
Yeah, it's true. We've got to understand this from a number of perspectives. And John, I'm glad you got involved in this as well. And we've got to look at this from a number of perspectives. First of all, there is still the presumption out there by many, and I'm talking about many dentists, many dental professionals, that periodontal disease cannot be treated. And that once you have periodontal disease, you're eventually going to lose your teeth anyway, and therefore we should go to the next step. We've talked about this, Kerry, where, as you know, we're probably one of the largest dental implant providers in this area. But still, there is, if we go with the presumption that the periodontal disease can't be treated and say, well, let's take this out before we lose too much bone and put a dental implant in, then that becomes another problem that we've introduced into the patient's system that may not be necessary. And the reason for that is that periodontal disease, for the most part, can be treated. But peri-implantitis, which is periodontal disease of the dental implant, is very difficult to treat, if not impossible to treat.
Yeah,
those people who are prone to periodontal disease are also prone to peri-implantitis. And so we want to, if at all possible, give the opportunity for the periodontal tissues to heal around the tooth rather than extract the tooth, and hope that when we put a titanium insert into that socket that we're going to get a better result than we would have had we kept the tooth to begin with.
Right. So we're talking with noted area periodontist Dr. Lee Sheldon, and we're kind of like covering this whole topic about deep cleaning and trying to get a real good understanding about why this is so helpful. It goes beyond basically the standard routine, let's just polish your teeth thing. And I wanted to ask you again about this word that we hear a lot. To me, it triggers a lot of memories of high school when they or college when they say calculus, but we're actually talking about your teeth here. Is that the same thing as bacteria like we've been talking about, or how does all that fit together?
It is the bacteria. The bacteria goes below the gum line. The body's first response is to calcify that bacteria. So calcium crystals that come in through the bloodstream are there to neutralize that bacteria, and the way they do it is to calcify it. The unfortunate part about calculus is that the calculus is porous and it collects more of the soft bacteria within it, and so it's perpetuating the problem. The other problem with calculus itself, which we talked about, we did the fractured calculus shows last year, right? Which you can look up online, is that the calculus itself is very tenacious. It grabs onto the root surfaces really, really tightly, and so when we have the feeling when we remove the calculus, we see this black stuff flying up out from under the gum line when we're doing a deep cleaning. That is not the whole thing. There's more calculus left that's on the root surface that has to be identified, and unfortunately we can't identify it very well by feeling it. We have to see it, and that's where the endoscope comes in, and we're going to talk more about the endoscope later on in this program.
Right, because I remember you explaining that's why it's kind of pernicious and not a good thing to avoid, because if it's under there, even if they say, well, we got everything above the surface, it's like the real mouth health kind of starts down below the surface of your gums. Am I saying that the right way?
It does, and there were experiments done, Kerry, where they gave the hygienist as much time to clean a tooth or teeth. And then they extracted the teeth. Teeth were going to be extracted anyway, and they looked at them under the microscope. And what they determined was, and the hygienists were spending anywhere between 35 and 40 minutes per tooth. Wow. They extracted the teeth, and they were only able to accurately clean the teeth 4 millimeters below the gum line. 5 millimeters below the gum line, you got some cleaning, and below 5 millimeters, it was nothing at all. So even though they felt they were doing a good job, when they looked at it under the microscope, they weren't doing a good job at all.
Yeah, so it really makes us think about the importance of getting this done the right way. Now, so here's a question that's maybe kind of like maybe related to it, but when we go to the dentist, and I'm thinking about like myself as a consumer that just doesn't really know maybe as much as you would hope we know. I guess that also brings up the question that not all dental cleanings, wherever you have them done, are like the same. You can't just assume that everybody is trained on the same way of thinking on this. Is that the case?
There are 3 points of it. One is training. Let's say number 1 is ability. Okay. Number 2 is training, and number 3 is the technological help that you get. Mm-hmm. Without those 3 in combination, we end up with what we talked about before, that you really can't accurately clean 4 millimeters below the gum line. So that the reason we got the technology that we did, and we got it 23 years ago now, almost 23 years ago, is that we knew, or at least we thought we knew, the importance of getting the root totally clean. Mm-hmm. Mm-hmm. Yet we knew that we couldn't see it unless I made an incision in the gum line and peeled the gum line back so I could see the root surface.
Right.
And what we were looking, so that I could see the calculus. So what we were looking for was a non-surgical way of accomplishing the same thing. Somebody came out with this endoscope, a tiny camera which goes below the gum line, the same way as you use the periodontal probe to measure the 4, 5, 6, 7 millimeter pocket, whatever you're measuring. We've got a camera about the same size as the probe, which magnifies the root surface and then allows our hygienist to be able to see the calculus and get the calculus out. And so the proof of the concept was that I took my top hygienist at that time, Rebecca, who's still working for us part-time. She's been in my office for almost 40 years. And we used the early technology where you could see shadows of calculus. You weren't really seeing it itself. And she started working hard at getting that calculus out. And once she did, and I would see the patient for reevaluation, let's assume about 6 weeks later, then I was seeing gum tissue that was tighter, no bleeding, and periodontal health from the hygienist, where the only way I could achieve that result was surgically prior to that. And so when we had that, but I had a real talented person, Rebecca, using it and really beating herself up until she got it right, then we saw opportunities to allow patients to have this kind of treatment done with no incisions and with lower costs as well. And that, of course, is a benefit to everyone.
Yeah, I was thinking it's really one of the benefits of technological improvement, right? Because now, rather than kind of guessing at where something is, you're actually able to spot it and then take action, which would seem like it really makes the ability to keep good teeth even that much more plausible than maybe it was 10 or 20 years ago.
It's true. And when you put the camera directly on the root surface, understand the mouth, I can only look one way. I have to open the mouth and I've got to look at all surfaces of the teeth. Well, I can't see the back surface of the teeth without using a mirror. And how good is a mirror looking down into a pocket? Well, here you can take a camera, you can put it down directly into the pocket, you can see exactly what's there and get it out. So even in terms of accuracy and improving the ability to access root surfaces that you can't look at by direct vision, the endoscope or the camera solves that problem.
I was really thinking about that's really, we have so many blessings of technology, but that's one that we don't think about a lot. We're talking with noted area periodontist Dr. Lee Sheldon of Sheldon and Furtado. It's that great dental facility right there on Sarno Road. And you guys have been like leaders of dental implants and just, I guess, good general oral health for all those years. And you have a great program that actually benefits both a new patient and actually also benefits the work of helping seniors. We're going to talk about that when we come back after the mid-show break. And we're also going to be talking about digging a little further on this tool that we've been talking about that really helps in this deep cleaning. If I'm saying it right, it's periodontal endoscope. Is that right, Dr. Sheldon?
You're hired, Kerry.
Well, good. I'm glad I got that far. But listen, this is an important discussion, and we're going to keep it going on the second half of Helping Seniors Radio. So stay right here on 90.3 FM WEJF.
To the second portion of Helping Seniors of Brevard, I'm John Harper. Show very interesting today. Our host and executive director of Helping Seniors of Brevard is Kerry Fink, and Kerry has his special guest for today, Dr. Lee Sheldon. So let's get back to the show, and Kerry, go ahead and take it away.
Thank you, John Harper. It's always great to be back here, and welcome back to the second half of the Helping Seniors radio program. It happens every Wednesday, lunchtime, 12 noon to 1 p.m., right here on 90.3 FM WEJF radio and online on WEJF.net. And then, of course, we make sure that we get these out as podcasts right away. So a lot of people find them, on everything from Amazon podcasts to iTunes to iHeartRadio. Wherever you get a podcast, you'll find Helping Seniors Radio. And then also we make sure the shows are also posted out on our helpingseniorsofbrevard.org website and our Facebook page at Helping Seniors of Brevard and our YouTube channel at Helping Seniors of Brevard. And the reason for that is we find out people will run into a topic, or they may have heard something, and then they want to go a little bit deeper on it and maybe share it with somebody in their family. They say, wow, this is really appropriate. This really has a lot to do with so-and-so situation. And then they'll share that link, and it ends up helping a lot more people that way. So whether you're listening to us live or catching this as a rebroadcast, we sure do appreciate your interest. As Joe Steckler, our president and founder, would say, we're all about getting you equipped on your aging plan, which we call getting your ducks in a row. And then, as we talked about in the first half of the show with our special guest, Dr. Lee Sheldon, noted area periodontist, who's been connected with Helping Seniors. Actually, you go way back with John Harper and Joe Steckler. In fact, you guys were all working together back in the days when Joe was getting those Joe's Clubs built for Brevard Alzheimer's, and then you guys were right there as the whole thing got started with Helping Seniors. But the point is trying to get good information in the hands of seniors and the families who care about them so they can make good decisions on that aging plan. And Dr. Sheldon, as we keep talking about, we keep learning there's no reason to try to go this on your own when there's so much good information and good help out there to help you be successful in your aging plan.
There is, and I think such an advantage of Helping Seniors, let's not even talk about dental. The advantage of Helping Seniors is there are a number of supporters for Helping Seniors who essentially have decided that their goal in life is to be able to help people. This doesn't mean you don't have a successful business by doing so. You do. You can. But in terms of the vetting that is done by Helping Seniors to make sure that the people who support Helping Seniors are people that you'd want to see yourself, provides that additional level of assurance that, in fact, when you call somebody, the Helping Seniors is recommended, that chances are it's going to be the right place.
And it's a great point that you bring up, because we have operated now going into our 12th year, the Senior Information Helpline, which is that free call from really anywhere in the county at 321-473-7770. That's the number, 321-473-7770. When you call that number, you're going to get nice, friendly Nancy Deerdorf, who is a person with 33 years registered nurse experience. She also ran one of the area's largest home health agencies for many years, and she is exactly, Dr. Sheldon, as you indicate, a person with impeccable professional credentials who has decided she's at a point in her life that it makes more sense for her to really get involved in what we're trying to accomplish with Helping Seniors in terms of helping people navigate all these situations. And so there is so much good help out there. And last year, she sent out a report to everybody that last year we took over 5,000 calls from seniors and their families. That was literally almost double what it was from the year before. And it indicates several things. It indicates that, number one, more and more seniors are discovering that there is a resource that can help them, talking about helping seniors of Brevard, but also just quite frankly, there's more and more seniors, either because people A, are living longer, or B, as we know here in Florida, it's growing like crazy because everybody wants to seem to move to Florida. And so getting good contacts and good information and knowing the right people to call is really so important. And that's why Dr. Lee Sheldon with Sheldon and Furtado PLLC, we can't assume that somebody has, maybe been in this area for 20 years and they know all the right places to call. They may have had great connections, where they're from, maybe up north or in the Midwest. And then they get down to Florida and they're trying to make sense of like, well, where do I find somebody that's really knowledgeable about helping with my teeth or with anything for that matter, all the things that we run into. And that's one of the reasons why I really believe so strongly in what we try to accomplish in helping seniors. And that's kind of like zips us back into our topic. We're talking about deep cleaning. And this is something that goes, Dr. Sheldon, you've really impressed in all the different shows, TV, radio, articles you've published in the Helping Seniors newsletter, which you find in the center of Senior Scene magazine. You always go out of your way to explain that while we're talking about specifically your mouth, because that's what a periodontist works with, it has ramifications that go so far beyond that. And we began the show talking about deep cleaning could really impact your overall health. And then we started talking about the technology, and I really wanted to get in the second half of the show to really talk about this periodontal endoscope, what it is and why it's so helpful in the overall battle to have really good health in the mouth, which can translate to helping you have good health overall.
Well, the first part of the show, we talked about the fact that that when you have periodontal disease, the way it's identified is with a periodontal probe, a little probe that goes below the gum line, and measurements are made. By the way, some people cringe over that. It can be done very comfortably. And so you make your measurements, and if you have a loss of support, if you measure more than 4 millimeters, then you have periodontal disease. And also, if the depth of that pocket is more than 4 millimeters below the gum line, then the hygienist has the opportunity of cleaning that area, but the opportunities of cleaning effectively before 4 millimeters has pretty much been proven to be pretty remote. So if you're trying to clean 6 and 7 millimeter pockets and the hygienist is trying to feel the calculus below the gum line and getting that out, where you may feel you've got a smooth root by cleaning the calculus off, in fact, when you inspect that root, there's still calculus there. And the important part of this is that we need to remove all the calculus or as much of the calculus as we possibly can in order to allow the body to heal properly. Somebody, for example, who needs continual deep cleanings, you've got a deep cleaning and then, all right, when the insurance allows it, we'll get another deep cleaning, let's say another couple of years, and you keep on doing that, essentially means that the first deep cleaning probably wasn't effective, that we probably weren't getting all of that calculus out just based on the data that we already have. Enter the endoscope, which means that the hygienist is not working on feel, isn't determining by tactile sensation whether the calculus is removed. Instead, she's inspecting with a camera that goes below the gum line and is looking at a screen, a video screen in front of her rather than looking in the mouth. Then there are opportunities for a patient to get the root surfaces totally clean and then get the opportunity for healing without going to periodontal surgery or minimizing the amount of periodontal surgery that you might do. Prior to our getting the endoscope, I was doing a lot of periodontal surgery. As soon as Rebecca got good with the endoscope, then I was doing very little periodontal surgery. That's how much of a difference a talented hygienist with the correct technology can make in treating periodontal disease.
Well, and it's also very beneficial, like we were talking in the first half of the show, too. We had done a show about this concept of, I think we called it fractured calculus, meaning, if I'm saying this right, it was the part that maybe even a really good hygienist wouldn't really understand, or they were trying their best, but they were kind of flying blind trying to get after it. And you talked in the show about how important that getting that removed actually can be. And I guess the the periodontal endoscope is really helpful in trying to get after that, right?
It is. I can talk to you prior to our getting the endoscope, because I practiced for 20 years without the endoscope. And what we would do would be to we'd do deep cleaning first, then we'd reevaluate. And if there were areas that were still inflamed, then the only way we'd be able to get access to it would be to make an incision in the gum line so we can see the root surface and get it out. And there are other things we do at that time too. John and I talked about bone grafts, for example, at the beginning. But what was really neat is the hygienist who had just completed the deep cleaning, a few weeks ago, would then come in during the periodontal surgery, and she would see the calculus that she missed. Yeah, because we had reflected the gum tissue back, and that's a very humbling experience for hygienists. And so I have, we have talented people here. Thank God we do. And of course, then at that time I was doing the training, and so I'm a bit of a taskmaster. I try to be nice about it if I'm a taskmaster, to make sure that things are done the way I want them done in the practice. And so we had the talent, and we had every bit of instrumentation except the scope. And so for the hygienist to do her very, very best and then see during surgery what she had missed, of course, is a humbling experience, also a learning experience, so that she may be better the next time. But at the same time, she's limited. She can't feel that calculus, particularly the fracture calculus, which, if left on the root, what the hygienist will do would be to smooth off that calculus rather than remove it. So whatever remains is smoothed off, and now it feels exactly like a root surface, when in fact you've got root surface, then some calculus, and root surface, then some calculus, and that calculus harbors toxins, and it harbors bacteria.
As you're talking about this, I keep thinking about this because I remember years ago when Joe had first began the work of helping seniors. He was getting it rolling, and he had us come to your office to film something called I think at the time it was called a perioscope. I'm not sure if it's the same thing, but I remember you were showing how, at that time, this was many years ago, that you could actually go up under the gum line. And I guess that technology has only gotten exponentially better since then. But how long have you been working with this kind of technology?
We got the first perioscope in the year 2000. That was the first year that it was developed.
Wow.
And and by the way, we still use the brand name Perioscope. It still is that brand name. There are other scopes now entering the market, and my understanding is, I know there's one more scope that's entered the market a few years ago, and my understanding is there are two more scopes that will be entering the market perhaps this year. So this is technology which I'm surprised never took off, but it really did never take off. There are hundreds, the low hundreds of dentists in the United States who have this scope. When you have 200,000 dentists in the United States, you only have a few hundred who have this scope. So it hasn't taken off. I'm surprised it hasn't. I come up with some reasons, but part of it may be the discipline that's required in order to be able to use the scope and use the scope properly. But so what you saw when we did that film, those video exercises that we did a few years ago, it's the same scope now that we had then. I'm not sure whether when you were here, you were there for the original version or iteration number 2. It was iteration number 2, I think, came out around 2016, 2017. And the second scope just was so much better. Rather than seeing little shadows or representations of calculus, you were actually able to see the real calculus on the screen. So it was much more definitive, much easier for somebody to identify what was calculus and what wasn't, which just shows you how much I admire Rebecca, because she was working on the original one, which was shadows by comparison, and still she was getting remarkable results with that scope.
I was going to say, I really think those first TV shows were probably with the first version, and I was going to say, kind of like really I guess, highlights the fact that you are always kind of like on the cutting edge of all this stuff. Because I remember you talking about, the CT scans. All that wasn't really in the typical dental office. We've already talked about. I jokingly call you like the father of dental implants along the Space Coast, because you were kind of pioneering that. And I remember too, I'd never even heard of such a thing as a perioscope until we were there filming that. But what I was going to kind of cap it with is, as a patient, experientially, having them work on cleaning your teeth with that, and hearing the person working on your teeth say, there's a good one, I'm going to make sure I get that out of here. And it really, you can just tell as they're working on it that it's not like they're flying blind. They know exactly where they're trying to go and what they're trying to accomplish with that particular thing. And it doesn't hurt. I mean, I can absolutely say.
Yeah, there is a level of confidence that the therapist, the hygienist, will then have, because all of a sudden with that, the hygienist knows what her limitations are just by virtue of the fact that she can't feel much below 4 millimeters below the gum line. All of a sudden you introduce a tool that allows her to see between the root surfaces, allows her to see, root surfaces aren't smooth. They have they have little nooks and crannies just like everything else does. And to be able to see into those areas and be able to see the entire anatomy of the root and know that you're getting to the right spot of the right root with the right instrument, to be able to get that and get that done thoroughly, and then to be able to inspect it and know that you've gotten it. That's a totally different experience for hygienists. It's something that they don't get trained in at school because the technology isn't available at school. So you see this level of confidence in hygienists just go way up, because now she says, now I know I've got it. Now I know I've got it out. And of course, that's confirmed when we do the reevaluation 6 weeks later and we find the gum is tightened up and there's no longer any bleeding.
I was thinking this is actually the topic of the article that you're going to be publishing in the Senior Scene magazine, where you're actually in our Helping Seniors newsletter, and your article for the month of February is actually going to be why do we use an endoscope? And so I'm looking at, you were kind enough to send along an early version of the article, and it says that when you started using the endoscope, you were able to reduce the amount of gum surgery by over 95%. That seems like just astounding to me.
Yeah, I was sitting here with nothing to do, Kerry, so I had to learn how to do dental implants.
Wow. Wow.
So, all of a sudden, I'm halfway kidding, but I'm halfway serious as well. If I can take the chronic periodontal disease and give it to my hygienist and know that I'm going to get a good result, and if it isn't a good result, then of course I have to do surgery. But if that's the case, then I can develop my own skill sets while I'm developing the hygienist skill set, so that she can do a better job with her patients. Well, that gives me an opportunity then to go out and learn the things at that time that I needed to learn. And so whether we're talking about bone grafts or lifting sinuses or taking bone from one part of the mouth and put it into another part, or rebuilding soft tissue for recession, whatever it was, it opens up the realm of possibilities for me so that I can be a better periodontist. And I'm a curious guy anyway, as you know, but to be able to take one segment of the practice and say, all right, that segment is taken care of, and you don't need my skill set nor my costs in order to be able to get this taken care of, then I can move on to something else that may be valuable for patients and for people in this area as well.
Yeah. Well, again, we're talking with noted area periodontist Dr. Lee Sheldon of the office of Sheldon and Furtado, where you have the pleasure of working together with your son, Dr. Matt Sheldon, who was named one of the top 40 dentists under 40. I guess that was last year or something. And then also Dr. Michelle Furtado, who is also, like you, a very well-trained periodontist. And together you guys are really able to tackle almost anything that runs along. And I wanted to spend a moment, since we've been talking about all these great tools and things that you have to help us not only maximize our mouth health, but in hopes that it will help us in our overall quest for good health. You've created a really good program that really helps us as a charity. Everybody forgets that, or it's easy to forget, I guess is a better way to say it, that Helping Seniors of Brevard is a charity. We can only do what you help us to do. We can't go no further because it's not like we have all this extra funding or things like that. It is really based on the goodness of the community that we're able to serve, like we talked about earlier in the show, more than 5,000 callers last year to the Helping Seniors info line, and also get this information out that we do. We call this the outbound portion. We do the TV on Space Coast Government TV. We do the radio show here on 90.3 FM, WEJF. We publish in the center of Senior Scene Magazine, and all of that we need your help to do. So you probably get a letter from Joe here in the next few days. It's called our annual giving campaign, and we don't bombard people with this, but Joe does send out a very heartfelt letter once a year saying, listen, help us keep this thing going. And Dr. Sheldon, you've come up with a really good thing that serves all of this really well too, because number one, it ends up being a donation to our charity. In our case, it's called Solid Bite Gives Back, and I'm going to ask you to talk a little more about it. But it really is good for us as a charity because we're a beneficiary. It's good for you as a consumer because you know exactly where you stand with the things going on in your mouth. But I also perceive that it's good for you as the dental office because then you really understand what's going on and can make best plans of what might be most beneficial to the person that you're talking with.
It's true, because when we see a patient, if you look at what the thought process is, all right, you've got to do the examination. You need a full mouth series of x-rays. Once the CT scan was developed with some of the software that we have right now, I can't diagnose correctly. I can't see things correctly without a CT scan. And each of these costs kept on going up and up and up, where if I were to charge what it would cost for us to do that, it would be cost prohibitive for someone to actually come in, or not cost prohibitive, but they'd question spending $500, $600 for an examination, which included all of those things. Yet I don't feel good about doing an examination without these tools. I don't think that I can diagnose properly. In fact, I can't diagnose properly. So along the way, we said, no, let's come up with a way that's going to benefit everybody. So what we did was to work with Helping Seniors of Brevard and develop a program where Helping Seniors of Brevard gets a donation of $50 or more to that organization, and we do the examination at no charge. And the examination includes the CT scan, and it includes the full mouth series of x-rays. So that way, the organization benefits. I actually think more people come into our office because of the reduced fee, and they feel good about the fact that they're donating to Helping Seniors of Brevard. So, you know, we talk about win-win-win all the time. I think this is a win-win-win. So that's how we interact with you in order to be able to produce as good a result as we can for Helping Seniors of Brevard, and at the same time get our patients looked at and diagnosed correctly.
No, it's so important. So if somebody is interested, it's called Solid Bite Gives Back. So I assume that they just get in touch with your office and you get like all the details or figure out how to get scheduled how does somebody go about that if they have an interest?
Yeah, the best way is to call the office 321-259-8000 and talk to any of our staff members, and they are familiar with the program. Just say you heard us or you just heard me on radio. You just have to say that, and they'll know the program that's involved and get you all set up for that, for the examination and charitable contribution, Solid Bite Gives Back program at the same time.
No, it's a valuable thing because it gives you it puts you, I'm talking about you as the listener, it puts you in control of what's going on because you get a really good read on where you are and what really makes sense. But it's not based on somebody's guess or even expertise, but it's based on expertise that comes from looking at very specific data, right? I mean, because you take the time to get all these important tools in play, like we talked about the CT scan and things like that, you're not having to guess. You can really see what's going on and give somebody, hopefully really good answers.
It's true. And I'd like to think that after my having done this for 48 years, that maybe I have some so, this is a great time in my life because I'm able to work and help people and give them direction. Sometimes maybe we're not the office for you, but at least I can tell you the different possibilities that are available that I think are predictable. So when people come in, there are times when we'll refer to other offices where it just isn't a good fit. That's fine. But there are opportunities for a 2-hour experience. And I don't think there are very many people that have had a 2-hour experience in the dental office, which is strictly diagnosis.
Yeah, and it's not a difficult thing. So, again, we're talking with Dr. Lee Sheldon of Sheldon and Furtado. You have a good website at solidbite.com. So I want to encourage you to get there and find out more. And that's the time we have for today. So we will see you next week. Thanks, Dr. Sheldon. We'll see you next week on Helping Seniors Radio.